emergency management within a university looks a lot different than it would look like if it was situated within a county or at the state level or at the national level. So we really focus on a lot of student, faculty, and staff preparedness for our campus, and that takes effect in very many different ways. I do a lot of activity planning, so a lot of events, just how you would think like student fairs do. We do preparedness fair every October. We do something for National Preparedness Month throughout the month, and really just trying to highlight, what things could happen, how to get students more prepared, and how to actually raise the awareness for it, because it's something that you don't really think about every single day. We go on about our daily lives and we do, things that we do daily, but we don't really think about the unknown or the unexpected.
Welcome to Public Health Careers. I'm your host, Emory Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Hey friends, welcome to Public Health Careers. In today's episode, you'll hear more about emergency preparedness and education from a university context, the importance of trying things to find more about what is for you and what isn't for you in public health, as well as how the pandemic provided a great learning opportunity and experience to build skill sets that were essential for this person. If you enjoyed today's episode or any of the other episodes, all I ask is that you hit the subscribe button, leave a review, and share it with someone who gets some value from it. This is really the best way to support the show and support the Public Health Millennial, getting out to more people, as well as to help other people navigate and transform their public health careers. So be sure to subscribe, leave a review, and share it with someone. Greatly appreciate you all. Okay, now enjoy the show.
Hey all, this is Amanda Mohammed, and I'm the program coordinator at the Office of Critical Event Preparedness and Response at Emory University, and you are listening to Public Health Careers.
Today we have someone working at the intersection of public health and emergency management. She conferred a Bachelor in Rural Community Development at Abraham Baldwin Agricultural College, then got a Master of Public Health in Behavioral, Social, and Health Education Sciences at Emory University. She currently works as an epidemiology assistant at Georgia Department of Public Health and a program coordinator at Emory University's Office of Critical Event Preparedness and Response. We have Amanda Mohammed, MPH, AEMT, GA-CEM, CHES. Welcome to the show.
Thanks, Emory.
Yeah,
super
how
excited
you doing?
To be here. Good. How are you?
I'm tired, but I'm doing well, and I'm excited to have you on as well. And I don't think I've had anyone speak a lot about like critical event preparedness and response. So I'm excited to hear about your experience with that and how you got into that. So excited for this conversation.
Yeah, thank you.
You're welcome. So before we get into anything, tell us, how do you identify? And maybe tell us a little bit about your personal background as well.
Yes, so I use she, her pronouns. I'm of Trinidadian descent. My parents are from the islands, so pretty much all my family is still back there. I'm a sibling of two, so I've got a brother, and I grew up in the Atlanta area, and I still work in the Atlanta area, but did a lot of different types of experiences within Georgia and outside of the states as well.
Okay, I didn't realize you're from Trinidad as well.
Yes.
That's awesome. Where in Trinidad is your family based from?
Yes, so my mom's side is from Pinal, and my dad's side is from Bearport. And I actually just came back a couple weeks ago from vacation after about 5 or 6 years of not going. It was just really nice to spend time with family.
Okay, that's awesome. Yeah. I'm actually heading to Trinidad in a couple of weeks for a wedding, so that's awesome to hear.
I just came back for a wedding.
A lot of people get married this summer, I guess.
Oh, yes.
Right. So before we get more into the conversation, now I know, like we mentioned, that you're into emergency preparedness and response. So talk more about the importance of preparedness, education, and outreach.
Yeah, so preparedness by definition really means, the state of readiness. It means, to be prepared, which really doesn't tell you much. Definition would sign inside a definition, but preparedness in itself is really just being ready for anything that could possibly come your way, whether, We just had, the COVID-19 pandemic that is actually still going on. We're not at the height of it anymore, but it is still there. And we had MPOX, but there's also, natural disasters and other things that we can't prepare for. We can prepare for, but we don't know when it's coming to us. So it's always good to, be prepared for these things that can happen. And then also realizing that even if we can't prepare for every single event, having some sort of tools or resources at hand that are ready to go makes us more resilient in the end, and actually increases our outcomes. So preparedness is strongly tied to health outcomes, and it's actually shown that communities that are better prepared than others, their health outcomes long term are, better favored than others. So when we're talking about, what I do at a university level, getting students prepared for any types of emergencies that could happen on campus, and also faculty and staff and whoever else visits our campus as well, and really just pushing that preparedness education and making people more aware of, the hazards that can happen within that community.
Very important work, and I think not highlighted. Well, it was very, very much highlighted. So, with like the pandemic and with the cutting of funding to public health, and just how that materialized itself throughout the especially early stages of the pandemic. That's how unprepared we were. So, I appreciate that work that you're doing, and more on like the education and outreach side of the preparedness. What are the types of things that you do to educate whatever types of communities you're working with around preparedness, around whatever types of emergencies or types of disasters and things that could happen?
Yeah, so emergency management within a university looks a lot different than it would look like if it was situated within a county or at the state level or at the national level. So we really focus on a lot of student, faculty, and staff preparedness for our campus, and that takes effect in very many different ways. I do a lot of activity planning, so a lot of events, just how you would think like student fairs do. We do preparedness fair every October. We do something for National Preparedness Month throughout the month, and really just trying to highlight, what things could happen, how to get students more prepared, and how to actually raise the awareness for it, because it's something that you don't really think about every single day. We go on about our daily lives and we do, things that we do daily, but we don't really think about the unknown or the unexpected. So besides activities and events, we do a lot of trainings, one-on-one trainings or group trainings. We've done in the past modules, preparedness modules that we push out to the community, and that's something that they can engage in on their own time and things like that. But we're also always looking for other ways to engage community as well. Community burnout is a big thing, especially after transitioning back over after COVID. We've seen a lot of fluctuations between how engaged people are, and it's realizing that you have to meet people where they're at and not bringing them to you. So really getting that community buy-in is something that we work towards a lot.
Yeah, very, very important. And I think especially in public health, it is how do we prepare ourselves for all the different things that might happen, and really focusing on that prevention aspect, because as we know, things can occur very quickly, and just ensuring that we have those mechanisms to work and to solve the issues that do come up is very important in the public health context. So I appreciate you sharing that. And before we get into your collegiate journey, I wanted to ask, what does public health mean to you?
Yeah, so public health to me means all-encompassing. It means holistic, and it goes back to my preparedness role. We bring in everyone in our community, all our stakeholders, and that includes the community as well. So when I think about public health, I think about everything and all these little pieces that, they may be small, but they pack a punch. They are impactful and meaningful to the whole situation. So we need everyone to be involved. We need that collaboration. We need that communication to make public health work.
Absolutely. So you got your bachelor's in rural community development at Abraham Baldwin Agricultural College. So tell us about that thought process. Did you go in there as a rural community development major? Because that's not something I hear people talk about a lot. So give
I
us a tea there.
definitely did not. I actually, growing up, thought I was going to be a veterinarian for like the longest time. So I did a vet tech program during my high school career and really was like, I'm going to do this veterinarian thing. And ABAC for short had a vet science program. So I was like, okay, I'm going to do that. This is me at like age 17 thinking that I, knew everything, and applied to the school, got in, and I realized very quickly my freshman year that vet science and biology was just not for me. I actually did not pass chemistry. So I had to really reevaluate, my priorities and what I wanted to do going forward. I was just like, I really realized I do not like chemistry. I don't like science. And I did in high school. I never failed a class. I had always, gotten good grades. So it was a strange time as a freshman to really be in that sort of situation and being so far away from home. And I remember having to call my mom, being like, hey, mom, this, didn't really pass this class. And my parents, being West Indian, are, I wouldn't say strict, but they're very, education's very important to them. So luckily, my parents are very understanding, and just reevaluated from there what may have been a possibility. I didn't really know what I wanted to do after that. ABAC in itself, agriculture is in the name, and they're a very large agriculture institution, and I didn't necessarily want to go down that route. So I didn't really figure out what I wanted to do probably until late my junior year.
Okay, well, I appreciate you sharing that context because that's important. Another thing that we both relate to, I went into college as a pre-vet major as well. Didn't stay like that for very long, but that's neither here nor there. But I appreciate you sharing that because I think that's important, and it's something that we hear many times. It's like you go into school with this one idea of what you're going to do, and then you realize that like these classes just aren't designed for you to do well, or like your brain just works in a different way.
Mm-hmm.
And I think that's fine, and it's just realizing that as early on in your journey, I think is important so that you can figure out what are the other things that I'm good at or I can excel at. And I could only imagine the Caribbean parents, because I also have Caribbean parents. So I feel you there completely.
Yeah.
Okay,
But
so
just wanted to add, I feel like a lot of people don't really find what public health is until maybe late in their, college career, or after that. And that was the same for me. I didn't really know or even know the word public health until I finished up my junior year and went into my senior year of college.
Okay. Well, I will come back to that in a little bit. So you had a few different positions while you were in your bachelor's program, and I'll name them out, and then you can like go through them and just share some different experiences that you had with them. So the first one I have here is a summer camp counselor at the Marcus Jewish Community Center of Atlanta. Second one is a public health intern at the U.S. Department of State. Then you had a study abroad experience in Rome. And then the last one I have is accountable health community screener at Tift Regional Health System. So talk about those experiences, maybe how you got into them or what you got from those experiences.
Yeah, so I'll start off with the summer camp counselor position. This is when I was trying to figure out what I wanted to do as a career. And I know I've always loved kids. I thought about being a marriage and family therapist for a little bit. So I thought about, maybe let me see how this summer goes, and spend time with, children and they're in a very different environment than I had done before. But I love that experience. I actually went back a couple of times while I was in between breaks for school. It was really just what it is, summer camp counselor. You are doing all the sorts of activities with the kids. And also, it was a good opportunity to kind of not be in that mindset of career and doing things that were closely related to a career. It was really just nice to have that kind of, different experience outside of it. But that summer camp counselor job may have not led me to any different roles from there, but it made me realize that, again, marriage and family therapy and children may not be my career going forward. Still love kids, but it just wasn't for me. After that, so during those few summers of doing that, I had to get an internship for undergrad. And that's when I started looking into opportunities. And in South Georgia, opportunities for public health and just nursing and any types of other health oriented career fields are very limited. When I was down there, the resources were also very limited, and it meant that I would either have to come back home and look for them or go elsewhere, which is fine. And sometimes those things happen, but still didn't know what I wanted to do at that point, had no career trajectory, didn't really know, what types of fields I wanted to go into. So it was a very stressful time, but I found this position that opened on the state website, and it was looking for a public affairs intern. And you could pick which countries you wanted to intern with, and no one from this school when I was there really had done something like that before in the past. The makeup of the school was very rural. So a lot of the students came from the surrounding areas. A lot of their parents had, grown up in farming and all these other types of industries that are more, local based. And I remember, applying for it and thinking I'm definitely not going to get this. In a major that isn't that recognized, rural community development, and I'm at a college that isn't as, heavily funded like others in the state of Georgia. So I took a chance and applied and actually got it to my surprise. But I was able to choose the country, and the country I chose was Trinidad. Because we had family there, and I thought it was a good opportunity. And, I had the housing thing figured out and I had the financial thing figured out, thankfully, and was able to embark on that opportunity. And that was probably, I would say, the top 3 or 4 amazing opportunities that I've had so far in my career journey. But I was a public affairs intern for 2 months, and we did a lot of outreach and engagement and education. And it was really less health focused than I thought it was going to be. So when I went down there, we weren't sure what projects I was going to engage in. It was really just something new that they had started in that office, allowing interns to come in. So it was their first intern that they had in a very long time. But a lot of it was focused on education and education outreach, and really going to talk to the colleges and the secondary schools down there about the importance of education and what the opportunities were within, their own home country and within the US and elsewhere, and the programs that they, can engage in that were fully funded by the US. But those were the best 2 months that I had spent down there. And then also, I think, if I remember correctly, that was within the year of 2017. It was the first time I experienced flooding in Trinidad. And that really opened my eyes to a lot of the public health concerns that they had during that time. I know there was a mosquito outbreak at that time because of the floods, and so that was relatively new. We didn't do a lot of public health activities, but that really did open my eyes to how public affairs and public health were connected at that stage. So during my sophomore year, as part of a class, I studied abroad in Rome, Italy for about a week, and again, wasn't public health connected at all at the base of it, but we did tour the World Food Program, and again, that small connection of public health was there before I even knew it was public health. And again, here's me thinking, oh, I could, work at the World Food Program. There's, different base offices across, the world. And it was just a really insightful thing to do as a sophomore and still relatively young, to see how, a program like that could sustain itself and provide these services across the world. And the World Food Program is known for delivering nutrition and really supplementing nutrition. So that, and it's, the connection between that and public health was there before I knew what it was. So I became an accountable health community screener at Tift Regional Medical Center when I graduated from my bachelor's program. My last semester of my bachelor's, I found this very small grant program that was attached to the community hospital that was there. And that was great because, again, graduating with this very, unknown to everyone else major. It wasn't just like, I graduated with a biology major or, a history major. It was a major where I had to find myself explaining to others what I could do in itself. And I was just really grateful. So during my undergrad, I took a couple of health focused and public health focused classes. Those classes didn't really come around until I was late in my junior year into my senior year, when they started to realize that there was, a kind of like a need for those classes. But I was just really blessed to have professors who recognized that I wanted to do those things, and networked me to the grant manager that was over that program at the hospital. So when I finished my bachelor's, I went into being a screener, and that really consisted of me being a social needs screener. I went into the ED every day, and it was part of a Medicaid and Medicare program, grant program. And we would screen individuals that came into the ED that had Medicaid or Medicare for social needs. So I would go and sit with patients every day, and have them answer a questionnaire that I would ask them the questions and they'd tell me the responses. And then from there, we would connect our patients to community resources that would fit and help their social needs. So it was a very infant pilot program that they had started across the US. So the hospital had to apply for that program. And I think at that time, there was only about 12 to 15 programs in the US for social needs. And now actually, I can't say because of that, because I'm not sure, but now Medicaid and Medicare have required that social needs are being asked when patients go into the ED and get admitted. So it is implemented and integrated into the reporting system now for healthcare across the U.S.
Okay, well, I appreciate you sharing those experiences. That's kind of crazy to think about, considering that you got your bachelor's in 2018. That wasn't something that's implemented nationwide, but I think it kind of just goes to show how much the health systems are shifting to this like value-based care, to this like community-based outreach model where they're able to improve health outcomes by addressing the social determinants of health, which was not something that was happening less than 10 years ago, which is blows my mind.
Right. And we have, case managers that work inside healthcare, but I think, that's only, again, a small piece of addressing the issue at hand. It's a much larger issue than that. But again, just really having that time to speak to patients and understanding that, hey, this patient can't make it to, their dialysis. What can we do for them? This patient, can't afford their medication. And when you look at it from that type of level, we sometimes, when we wonder why we have a lot of readmits into the healthcare system, it's social needs. And all these things have such a wide impact and a wide reach with health outcomes, with preparedness too, and how prepared people are. It always fascinates me how everything is so interconnected to people's health.
Absolutely. And in North Carolina currently, just to, like, stem off of that, in North Carolina, there's the Healthy Opportunities Pilots Program, which is essentially one of the first pilots around the US, I believe, that is using Medicaid dollars to pay for socially determinant of health needs. So, like, food, transportation, housing, ACEs, and I think there's one more thing, and it's quite fascinating. But I hope that this is implemented and is taken up across the nation, just as the work that you were doing was one of the first ones to happen, and it was taken up across the nation, because I think that is definitely how we get to the root of these issues, because it isn't that people are going to the hospital all the time just because they have like they need a huge set of treatments. It's like, what are the social contexts and the social conditions that they're living in that are creating the diseases, and how can we get to that root cause? And before we go on, I wanted to just highlight some of the things that you did say there. So previously, so you in the summer camp, you're saying that you learned what is for you and what is not for you. And I think that's an important takeaway for anybody, especially bachelor students. It's like you went into to your undergrad program wanting to be a vet, then you're like, chemistry not for me, maybe I want to do something with like families and stuff, and then you're like, not for me. And I think that those are good learnings to have. And the other thing is applying to that public affairs internship at the U.S. Department of State, and you thinking, hey, I'm not going to get this. And I think it's important that you're highlighting that, because a lot of people are that same way, but because of that, they would say, oh, I'm not going to apply. But when you do apply, the worst that can happen is you get that no, and you're in the same position. So I'm glad that you were able to say, like, even though I didn't think I would apply, I applied to this and I was able to get that experience, which is very, very important. Did you want to add something to that?
I think the only thing I would add to that is it's important to just apply yourself in any, type of experience that you possibly can. You never know. You never know what types of experiences and opportunities may come from something. And again, back to what you were, I just want to emphasize what you were saying. The worst thing that could happen is they say no, or it doesn't happen, and you move on to, the next thing.
Yeah, and even from that, you're building the experience of applying to something, and that in itself is something that helps you to grow as a person, as a student, as a professional in this. And it's also cool to hear you talk about like being able to go work in Trinidad and seeing the floods that happen. Flooding is crazy in Trinidad sometimes, and it's only getting worse. As well as it as you said that, like, it just highlights things that I don't think about being in the US, like dengue fever or West Nile, things that you get from mosquitoes that you don't typically hear about much in the US, but are pretty prevalent in Trinidad and Tobago. So I appreciate you sharing that, because I kind of like just jogged my memory. And earlier on, you said that you only found out or learned about public health in your junior year. Can you talk more about that learning process and like how that kind of shaped your perspective of your career going forward?
Yes. So public health is, and I feel like it may be like this for other people as well, but it's a very personal connection. And I think we find our career paths sometimes to be very personally connected to who we are and the types of experiences we've had in our lives. So it was actually during a class that I had. It was a rural studies class, and we learned about all sorts of things, rural issues, and there was something called the Foxfire Project. We had to interview an individual in a rural community and tell their story. And me not being from, that area, it's like, who am I going to interview for this project? And I love storytelling. I love that kind of using voices and using stories to, shed light on issues. And we do that a lot in public health as well. But I chose my dad. So my dad was actually a migrant farm worker back in the 80s. I think he did that for about 10 years or so. So he would go from Trinidad to Canada for about 6 months during the farm program when they had it still, and would do farm work and then come back. So he actually got injured a couple times doing that. But I was really interested in farm worker migrant health, and that's what really sparked the love for public health. When I started and figured out oh, this is public health. Like, this is what we do. This is, the types of things that encompass that. So being able to tell my dad's story within that class project really just opened up the floodgates to all the possibilities that I could have done in public health. So I like to say that my dad actually started the love that I have for my career.
Well, I love that. That's awesome. Yeah, that truly is awesome to hear. And so, were there any undergrad takeaways that you wanted to share before we move on?
I would say definitely as much as you possibly can without burning yourself out. Get involved in all the types of experiences and opportunities that you can find. And if you can't find them, there is someone that knows where they are and what you can get involved in. So don't be afraid to network with other students, with your professors, with people outside of your university, or people that you don't usually have a day-to-day contact with. I know it can be really nerve-wracking to reach out to someone new and talk to them, especially when you're wanting something in return. But I've found that throughout my career, people are actually very responsive and want to help other people. And the worst thing that they could say is no, and you just move on to the next person. But it's really important while you're in your undergrad to start that networking.
Great insights. And yeah, it is all about building those relationships and making those connections and continuing to have those conversations. And because you never know who's going to be the person that could help you in whichever part of your career. So I definitely advocate for that as well.
Mm-hmm.
So you spoke a little bit about the career that you had after you graduated as an accountable health communities screener. And then after this position, or maybe it was as well as during this position, you began your Master of Public Health in Behavioral, Social, and Health Education Sciences at Emory University. So tell us about the thought process of going into here or like wanting to pursue a Master's of Public Health.
Yeah, so I took a gap year for my bachelor's. So I did that accountable health community screening during my gap year. So I did that for 1 year, and I thought I was going to be out of undergrad before I pursued a master's for at least 2 to 3 years. I really wanted work experience to see if I actually did want to do public health before I invested that time and funds into a master's program. And when I was doing my screening throughout that entire year, I just really had an inkling like, maybe I just need to apply. Maybe I just need to jump for it and see where it goes because I really loved what I did. And I felt like in that time, I'm someone who likes to make impact and likes to see that impact. And I know I was making that impact during my year of screening, but I wanted something more. I wanted to do something more. So I decided to apply for my master's, and I only applied, honestly, to 2 programs because, again, the insecurity and imposter syndrome creeped in and was like, you just applied to 2 programs, see how it goes. So I applied to Emory and I applied to the University of Arizona that had a really good farm worker and migrant population public health focused degree. So it was between that or doing behavioral and health education sciences at Rollins. So didn't know which one I was going to get. I actually got into both of the programs and had to make a decision about what program I was going to go into. Arizona is a really good school as well, but just, funding and the cost of living, I just couldn't pursue that path. And also I am from the Atlanta area, so coming back home and, pursuing a master's where, I had somewhere to live and some other things that were, taken care of sounded more reasonable for me to do. So I accepted and I ended up doing my master's at Emory. And I didn't really know what to expect coming in. I'd heard things about Emory in the past and just didn't really know, coming from a bachelor's program where all my professors knew me, all the students knew me, and it was a campus of, I would say, about 3,000 people, and we knew each other. coming to a much bigger school and a much bigger program, I didn't know what to expect, but I found that professors got to know you, the students got to know you. It was a very close-knit master's program, but then COVID happened, so I only got about a semester and 2 months of in-person learning, and the rest of my master's program was virtual.
Thinking back on it now, like reflecting on it back now, like you spoke about having imposter syndrome and that being one of the reasons that you only apply to 2 programs. Let's say that someone is thinking about applying to a master's program right now, a master's of public health or any other like master's program related to health. What kind of advice would you tell them to kind of like overcome that imposter syndrome?
I would say apply. I know it's so hard to put your worries and all that aside and have that disappointment come potentially, but what I did a lot was when I filled out my applications and I did my personal statements, I had a lot of my professors and friends look over my application, just so I had second and third eyes on it. But just apply. I mean, have faith and trust in yourself and your abilities and know what you're capable of, because you can do a lot of things, and you never know. You'll see the end result when it comes, but there's always, more chances down the line.
Yes, you absolutely can do great things. So definitely don't discount yourself or pull yourself out of something without even trying, because you never know what will come. So I appreciate that and great advice. So during your time at Emory, you were a graduate research assistant at Emory Centers for Training and Technical Assistance. Can you tell us more about that experience?
Yes, so I was working within academia consulting, which is another type of consulting that isn't really talked about. There's a lot of business consulting and public health consulting, but it was really focused on larger programs, so both academia and research programs. I worked a lot on tobacco cessation projects and the Alzheimer's Foundation projects as well. And I did evaluation work. I, wrote reports. I wrote research articles, worked on a lot of different collaboration types of projects from there. But again, it was all virtual. When I started, we were in person working for that, semester, so that couple months, and then COVID, and we moved to a virtual environment. I was very lucky that the team I was working with, super flexible. They had done virtual work in the past. Everyone was pretty much remote. They had staff kind of scattered all over the US. So that kind of transition from in-person working to a virtual environment working, thankfully for me, was very smooth. But in terms of project and work, it was a great experience because I wasn't held to certain projects. Even though I was assigned to certain projects, they still allowed me to go outside of that boundary and say, I'm interested in doing this. Can I work on this project for, a couple weeks? But I found out I really like consulting. I still kind of do that in my role today. It's not traditionally consulting, but sometimes I do get pulled off to go and do different projects across the university and really have that, input for, the greater good and things that, relate to how prepared we can be.
And you also had quite a few roles at Rawlings School of Public Health. So I'll I guess talk about some of the pivotal roles. So I'll just name a couple of them that I have here, and you can either talk about them or not. But you're a student representative, you're an RSPH education committee, you're a community outreach liaison for student outbreak and response team, and you were a student ambassador co-leader. So tell us about those positions or any of the roles that you had in Rawlings that were like most fundamental to you.
I went into my master's program and I pretty much did all the things. I don't think I can name one thing that I didn't really get my hands involved in. And I kind of took that from my undergrad. I just really like people. That explains the role I'm in today. Really like people, really like collaboration, really like getting involved in different things. So I was an ambassador for the school. And that really was just, getting other students to not only apply to the school, but, kind of figure out why they wanted to come to Rollins, what they wanted to do within public health, and just be that voice for, possible prospective students that wanted to come to the school. So I always found that during my career when I was an undergrad and trying to figure out where I wanted to go for my bachelor's, that speaking with other students is really what, at the end of the day informed me why I wanted to go to a certain school or do a certain thing. And I really just wanted to pay that back in that capacity. So that was a really fun role. Fortunately, again, didn't really get to do much with it after we pivoted into the pandemic, but during that time, I was also involved in the student outbreak and response team at Rollins as a community outreach liaison. So that's actually the oldest group that they have within the university, within that program, the Rollins program, that focuses and trains students on outbreak response. I actually didn't go into my master's, again, knowing that I wanted to do emergency management or outbreak response. I actually didn't really know what I wanted to do. With my public health degree, when I finished, I thought it would be something, health education. Thought I'd probably go and work within the public health department. So my knowledge of what public health was still very, very small and very limited until I went into my master's program. But I joined this organization because I thought, the things that they had done in the past were really cool. So in the past, they've done flu vaccine drives across campus. They've done it within the county. They've trained with CDC employees in outbreak response. So their breadth of knowledge and training was very expansive, and I wanted to tap into that. So I joined that, and I got in, and then we're doing our usual day-to-day student, run organization activities, and pandemic happened. And lo and behold, that's how I actually got my epidemiology assistant position, was actually from that student work. They had been used in the past for outbreak responses and CDC activations and using students in the EOCs, so EOC Emergency Operations Centers. They had been used in other types of responses in the past, but this is probably the biggest response that these students were tapped into. So myself and a couple of my fellow Rollins colleagues were actually pulled into response very, very early on. And we worked with the public health department. So we've done the call centers in the beginning, and then we transitioned to all virtual. That's when they weren't having anyone in person, once we started to figure out what exactly COVID was and what it was doing to the human body. So we transitioned from doing in-person call centers to virtual. All the operations became virtual. Epidemiology assistance and epidemiology oversight became virtual. And contact tracing didn't really happen until later on in the response. But I remember, doing my master's, program schoolwork, and then in the evening transitioning to actually working within the response. And for about a month and a half, it was all volunteer. I forgot how many volunteer hours we put in, but it was a very long month, being both a student and actually being, within the response. No one knew what to expect, but, I think it was a really pivotal time to be a student and also to experience a public health emergency. And I think at that point, while, there were so many, uncertainties and, unknowns, it was for me a personal, wow, this is what it means to do public health. So in a very strange way, it was both a good and bad experience, to kind of get thrown into the field, and to, partake in that response. And I'm still in it. I still do it every single day on top of my Emory role. And I love it. I love having, doing epi skills. That's not something that I did my master's in. It's not necessarily something I took classes in either, and I kind of just learned it during the response, and as a just-in-time volunteer, and kind of just kept up with it from there.
I could only imagine what that was like for you. And yeah, with the both like the pros and the cons of being thrown into this pandemic situation where you're getting to actually get real-time experience in public health. Granted, not something that we like really wanted, but
Right.
in that you were able to learn and grow and pick up on this other skill around like epidemiology. And tell me, what was that like for you? Because as you said, you didn't get a master's of public health and epidemiology. You probably took maybe an intro epi class, I'd imagine. So tell us, what was it like for you to learn epidemiology, like on the job, essentially?
I had a lot of help from my fellow colleagues and from my supervisor, my direct supervisor. But luckily, the role that I was in wasn't necessarily, what an actual epidemiologist within their role would do. So, epi curves and all that, I understand it, but don't tell me to actually create one. Um, all the props to them and what they do every day, because data is not my thing. So what I did day to day was really, data entry, data cleaning, making sure that records were accurate for what the information we knew at that time. Early on in the pandemic, when we were doing this, a lot of the infrastructure and tools that we use now were not built. We had used it for different things in the past, but for this type of response, they had to build things in real time. So the tool that we use today looks extremely drastic from what it looked like in day one. It was very basic, but we had a call log. We'd have providers would put in information and it would come to the state, and we would triage every single case based on, the tests and everything that was available at that time. So a lot of what I did was, just data control, and it's still pretty much what I do today. Just going back and making sure that records are accurate. We're still getting a lot of information from early on in the pandemic. Data reporting was very slow at certain times, just given what was happening during that time of the year and that time of the response. So right now, we're just going back through records and making sure that we have as much information as possible within those records as we get it.
Okay, yeah, and that makes a lot of sense, and that's awesome that you were able to pick up on that skill set and build it out, and while also acknowledging that you're not an epidemiologist and you're not like advanced in a lot of this, but you know enough to be dangerous in it, which I think is very important as a public health professional.
And I think what really, helped it too is we were all learning at the same time. No one knew. We were in our first, actually second semester of our first year of our master's program doing this. And we hadn't touched these types of classes before. It was not many of us had actually had any type of response knowledge or experiences. So having that lived experience and sharing it together was very impactful.
And was this role and like this experience something that made you say, wow, this is something that I really want to do more of, and like emergency preparedness and response is like a part of public health that I kind of enjoy and I like? Was that what came out of this role, or not so much? Was it something else?
It was a part of it. I think all the culmination of what I've had throughout my bachelor's, my gap year, going into my master's, kind of put it all together and made me realize there is a feel for this emergency management. And I think things for me kind of just fell in place. Little bits and pieces of experiences and opportunities that I've had have built up to where I am.
while you were also in your MPH program, you were This is Public Health Student Ambassador at the Association of Schools and Programs of Public Health. And quick funny story here is that I only kind of like got onto Instagram and like started following public health accounts after I graduated from my master's of public health. And then I realized there was this is Public Health Student Ambassador program. And I reached out to them to be a part of the program, and they're like, you're not a student.
Darn.
Right. I was like, why didn't I know about this earlier? But yeah, tell us about that experience.
That experience came from me being a co-lead ambassador at Rollins. So what they had done, it's an initiative through the Association of Public Health Schools. They pretty much take the leaders from public health programs across the U.S. and plug them into the types of programs and initiatives that they're doing through that larger association. So it was all virtual. It was a virtual experience, but it was really nice to connect with other students and professionals from outside of Emory and to hear, their correct career trajectories and what they've done in their past and what they want to do going forward. But it was, again, a more like an ambassador role. So a lot of the online virtual chat forums schools do during the year. I think there's about 2 or 3 that happen every semester where students can get online and they can ask other students or, other program staff at different schools questions about their master's program. So we would fill in for those, and it was really nice to chat with other students too and see where they were kind of thinking about going to school and what they wanted to do, and kind of help them point them in the right direction, if you say, for the types of things that they were wanting to experience during a master's program. And we also did a lot of social media outreach during that time, just, posting and engagements. And of course, I did a preparedness engagement. We had to do a social media takeover week. And I was like, I'm going to do preparedness week. And all week I posted about preparedness tips and pet preparedness. So that's another thing. Didn't become a veterinarian, but preparedness, and animals still go together. So I still found, a way to smush them together and have that experience. And also, the rurality background that I have, large animal and farm animal preparedness. A lot of people don't think about those two things going together, but it is a very large focus area.
Yeah, and just highlighting the different intersections of being able to do work that like kind of interests you, like going back to like that veterinary animal importance of animal type of work, and how you were still able to do a little bit of that. And yeah, I feel like I haven't seen much of those takeovers lately from the Association of School Programs. Probably, I don't know if it's because it's summer, but they used to be doing them all the time, and I used to find them very fascinating to just see like students being able to share what they're doing throughout their programs, what they're learning, what they're interested in, and giving you like a real-time perspective on that. So hopefully they start that back up if they have stopped it. But that was a really cool initiative that they did. And did you have any other takeaways, or did you have any takeaways that you wanted to share from your MPH program with us?
I would say the same kind of goes for what I shared with the bachelor program, the networking and getting into experiences that you don't think you would enjoy or you don't think you would see yourself in, because you never know. Your master's program is the time that you want to explore these things. You can do it after you graduate, but it's so much easier while you're a student to get plugged in to those different avenues. When you say, hey, I'm a student in, this program, I'm looking for, this type of experience, or I'm looking to, engage in this type of work. It's much easier when you're coming from being a student currently to get plugged in to those types of those experiences. So don't wait. But again, even if you graduate and you realize down the line, hey, I see this, really cool opportunity, maybe I can get involved in it, reach out to your network and see. You never know where that can lead you to.
Good insights for sure. And so you said you started you're currently still doing the epidemiology assistant position with the Georgia Department of Public Health, which was started during the pandemic. And you mentioned that you use tools to collect, I guess, like I'm losing the word here.
You're good.
What's the word? Oh
I
my
would just say
god.
it's pretty much data, all sorts of data, personal health info, just demographic data, and test results come through that system as well. So it became a very sophisticated system as the pandemic went on. But yes, I had that position during my master's and I still have it today.
Okay. And are there other things that you do? So you said that you use this tool to collect many different types of data. You do data control. Is there anything else that you do in this role, or those like the majority of your responsibilities?
It's the majority of it. Sometimes we have some special projects that come up. So I actually was able to host a health educator table during one of our MPOX vaccination drives in Atlanta. And sometimes we have special projects that come up through state requests that sometimes we can get plugged into. Sometimes also there's natural disasters that happen within the state. So I'm also signed up as a volunteer. In Georgia, we have something called Serve Georgia. So I've got my information in there, and pretty much it's a recall volunteer system that can call up volunteers when needed. So there was a really bad tornadic event that happened about, I would say, an hour and 20 minutes from Atlanta a couple months ago, and volunteers were recalled through that system. So I tried to help out, but they had already gotten assistance for it. But those are the types of things that sometimes, just depending on your role, things that you can get involved in. So if I was going to response within my epidemiology role, I'd be fulfilling the public health. I'm going to get this wrong. I believe it's ESF8, which is an emergency support function, and that encompasses public health. So if I were to deploy into a zone for a disaster, I'd fulfill that type of role. Whereas at Emory, if I deploy within this role, it would be within the university when I do.
Okay. And that leads into the next question. So you're currently also a program coordinator at Emory University's Office of Critical Event Preparedness and Response. How do you come into this role, and what do you do in this role?
Again, networking, going back to networking, it is so important. A lot of my roles, and I didn't mention this before, have come from some sort of networking or just, talking to professors or students about what I wanted to do and see if they had any leads. And this is how I got this current position that I'm in. So when I was a academia consulting student during my master's program, one of the staff members had actually had contact and had done work with the executive director in my office, and she knew I loved outbreak stuff. I wanted to do response work, and she pointed me in the direction of, hey, there's an office at Emory that does this stuff. Maybe he knows where you could look for jobs and those types of who you can get in contact with. So I actually reached out to him and didn't really know where it was going to go. They didn't have any positions open at that time. The office is really small. There's 8 of us. So you can imagine when, things do happen. We don't have a lot of people, but we make it work. So there was no positions open at that time. I had applied to, I think, I would say about 35 or something jobs my last semester of my second year of my master's, and had a whole Excel spreadsheet going of jobs, and it was just rejection after rejection. And I think I was about 10 rejections in deep that time when I was applying. I was like really just, giving up on the whole process. It was still COVID, height of COVID, and, a lot of companies weren't hiring at that time. Companies were still working virtually. So I didn't really know where that was going to lead me at the end of graduation, whether or not I'd have a position after I left Rollins, but I kind of just came across it on Emory's work portal. I had actually applied for the Emory position and a CDC fellowship within their division of preparedness at the same time, and heard back from both. So I actually was accepted for that fellowship program, but was really holding out for the Emory one just because I was so familiar with the university. I liked the work that they were doing, and it just seemed more like I'd have more opportunities to do things that were different. I'm a person who doesn't like a lot of repetitive work. I like to kind of experience different things from time to time, and CDC fellowship, as cool and amazing as it sounded, I knew that knowing myself, being held to only a certain amount of, activities and things I could get engaged in because of what the fellowship wasn't for me. So I ended up going with my current office.
Self-awareness, I think, is very, very important, and understanding what you want from a role before taking it is also very important. So that's good that you're able to like vocalize and highlight that. And I think it's sad, but good in the sense that I also remember creating Google Excel sheets and for jobs and stuff. The only thing is like I never got rejections. It was just like ghosted. So I'm glad that you at least getting rejections, because I think that closes the loop, because many times you don't hear back from organizations and they don't say anything for months and months at a time, which is quite fascinating. And hopefully like that practice can change, especially in public health. But that's neither here nor there. But
yeah.
Can you talk more about some of the roles that you're able to do? So you said you're able to do a lot more, and I could imagine that things are very different, maybe day to day or week to week. What are some of the main things that you're able to do in this role?
So besides the preparedness education and outreach that I am responsible for in the office, I do a lot of student engagements, which I really love. I love to engage with the student body. So a lot of the activities and things that I do day to day are very student facing. We also interface with faculty and staff, which I also love as well. There's some amazing people at Emory who just really know their stuff, and getting to collaborate with them day to day is amazing. But besides that, we also have a student EMS program, Emory Emergency Medical Services. They are students, but they are licensed EMTs within the state of Georgia. So a couple of colleagues in my office supervise that service, but I'm also an advanced EMT. I actually came out of my master's program, started working with the Office of Critical Event Preparedness, and we had gotten an Emory EMS under our office. It was the first time ever. They had moved from under the police department and were getting cut because of COVID, and we kind of took them under our office. And I remember my director going, "Hey, you interested in going through our EMT program?" I was like, "Okay, yeah, sure. Why not?" Yeah, it was a very interesting and very long year of education. And I said when I was done with my master's, I'm not doing anymore. I'm not doing a PhD. I can't do it. I really want a break. And here I was sitting in a classroom full of 30 something Emory undergraduate students learning how to become an EMT. And Emory students, they're so much smarter than me. I didn't take chemistry in college, didn't do these life sciences, had absolutely no background in life science at all. So I think that really challenged me. I think that is probably the most challenging thing that I've done so far. I thought my master's was challenging. That EMT program was challenging because I just didn't have a background. I had no background, and I love these students so much, but they're, sitting next to me and just naming things off the top of their head. And I'm sitting there like, I have absolutely no idea what bone we're talking about right now, and I should. But going through that program with them and being both a student and an employee at the same time was an interesting experience, but it was such a great learning experience and a growth experience that I am so grateful for. I don't get to use it as much now. My day-to-day role is a lot in itself. I don't get to jump on a truck every day or every other day and go out with them, but they do some amazing work for the community.
Yeah, well, shout out to you for getting through that, even though it was very tough. I think it just shows like the resilience in you and being able to do that. And I could imagine just how much learning and appreciation for the work that EMTs do came out from that as well.
Oh yeah. I always say there's a reason I didn't do a medical, focused career before I did public health or, in conjunction with public health. And here I am in this EMT course doing something I never saw myself doing, but I loved it. Again, going back to you never know what you're going to like until you actually do it. My mom is a CNA, so it was really cool to kind of come back home and be like, hey mom, like can you help me with this? So that was a really great bonding experience at that time, me going through, an EMT program and her being able to help me through it.
Yeah, that's definitely great. And you spoke a little bit about in this role that you do a lot of work around like engaging students in preparedness and response. So let's say that someone is starting up a role at another university somewhere in the US or I guess anywhere in the world, and they're thinking about doing work to engage students around preparedness and response work. What types of tips would you give them in doing this work effectively?
Definitely understand your community. I, as a public health professional coming out of school, knew this, but I think sometimes we forget that and we think that, from our knowledge and our experiences, that is what it is. And it's definitely not. So, really getting to know who you're working with within that community. The Emory population is so diverse. Every day and every other day, I'm learning about a whole nother, type of thought process or the way someone else looks at the world. We have a lot of international students, faculty, staff, and people who come to study, and their way of perceiving threats and disasters is not the same as someone from like south of the US or north of the US. There's different names for types of different events. I actually remember speaking to a student and they didn't know what a tornado was. They just don't have them where they're from. Whereas, someone from the Midwest is very trained and well versed in tornadoes. So just knowing where your population comes from, the types of experiences they've had, really informs how you build your programming. And your programming changes. You can build a program, but in a way, you can have that canned program and it still needs to be adjusted from time to time, depending on what new information you get. So I'd say, 1, get to know your community. 2, don't be afraid to change your programming and really get that buy-in from your program. So don't build your program in a silo. Really have, that collaboration across, the community that you're working with, input, what they think and their opinions into how you build your program, because the program is for them. It's not for you. So they're going to get, what they want to get out of it with whatever you put into it, but also with whatever they put into it as well. So it is both a buy-in process. And also be open-minded. Things change. You have to learn how to be flexible in an emergency response. You have to be very flexible. I can't tell how many times I've planned things and just, it changes. It changes and I can't use it. And I have to pivot. But knowing that it's going to happen really, sets you up for success rather than for disaster.
Yeah, great insights for anyone that's interested in that kind of work. And then before I move you on to like your future what you want to do in the future and Furious 5. You also have a certification as a GA-CEM, which I think is around emergency management. But
Yes.
you tell us more about that and like why you got that or like what you learned from that certification.
Yeah, so it's the Georgia certification for emergency managers. So I am a certified emergency manager now. That was about a year-ish long process. So I've had to do classes in emergency management to get that certification. So I do the classes and I've had to sit for a test in order to have that credential. But it's really just another way for me to say to the community and to, the people I work with day to day that, hey, I'm, engaging in professional development. I, know the newest things that are coming out within the field and just really, putting back into the field the things that I know, but then some new things as well. So I think it's really good if, say for instance, someone really likes project management and program management, there is that PMP certification. It's just another way to say, hey, I've, certified my skills in this. And sometimes jobs really like to see that as well.
Yeah, well, I appreciate you sharing that. And I think it's important just to highlight like, okay, I'm going to be in this field of work. How can I continue to build my learning and get more certified to become more competent professional in this space of work? So that's awesome that you're doing that. And I definitely think it's something that everyone should think about, especially as they're diving deeper into what their actual career path might look like.
Yep.
And then before I move you on to the Furious 5, I would like to ask, where would you like to see yourself in the future?
I'll be honest with you, Omari, I don't know. I don't know. I know the things that I like. I know the things that I don't like right now. I'm open to trying new things, but I think somewhere down the line, don't know if it's, 5 years from now or 10 years from now or somewhere at the end of my career, since I'm doing university-based response work and engaging with this type of community, I would really love to engage in a more rural area. My background is rural. A lot of the things that I do on the outside of work are still rural focused. So I would love to see that aspect of it. But yeah, I'm kind of just day to day learning new things, networking with new people, trying to see where that leads me.
The poetry of public health career paths. I think there's no wrong answer, and there's always new development and understanding in where you can go. So I like that, and I think that is a good answer to have, because you don't want to box yourself in, but just knowing that there's so much more out there and you're learning every day. And to that point, it's like you have no idea what might be that next move for you or anything like that. So yeah, I appreciate that. So moving on to the Furious 5, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
I would say networking, getting involved early on and not waiting, and really just having an open mind. There's so many different things that you can do in public health that I'm also learning about at this age. And I think I will keep learning about as the field continues to grow and evolve. Everything is public health. At the end of the day, at some point, there is a connection to public health. But again, just going back to being open to your experiences and figuring out what's right for you and what's not right for you.
Love it. Number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
Again, start early with the networking, but also I would say reflect on whether or not you're, suitable for the path or the career path you think you want to get into. Not everyone is cut out for response work. Sometimes I find myself very stressed out. It's normal, it happens, but I think really just being reflective and knowing, what your strengths are and what your capabilities are will help you in the long run. And, that goes back to the public health thing as well, knowing what career field you want to get into, that thing that makes you fulfilled at the end of the day, rather than looking back and saying, I don't like the role I'm in, I don't like, this field. Finding something that you feel fulfilled in at the end of the day and makes you feel like you're making an impact is what matters.
Number 3, what's something you're working on improving in your life right now, Amanda?
Communication. Communication skills. I would say both in my personal and my professional life, especially, being in response, you need to be an effective communicator. And that goes into your personal life as well. And I think that's something we can all work on at the end of the day. But yeah, learn how to do that better.
Yeah. Number 4, professionally, do you recommend anything outside of networking?
Yeah, I would definitely start looking into if you like social media or like to be on Instagram or LinkedIn, following other people that are, that you find interesting, whether in your career field or a field that you think you want to be in. There's so many people on these platforms like Emory that are just, filling the world with amazing content and things that can really help you as, a professional and as a student. So engaging with those platforms and those networks, really important.
Love it. And then last but not least, where can people connect with you?
Yeah, so I'm super open to connections. If you haven't figured that out throughout this whole hour and something that we've been discussing, but you can find me on LinkedIn, just Amanda Alicia Mohammed. You can also find me on Facebook. Yeah, just feel free to, if you're interested in preparedness, if you want to learn more, or just learn more about my career path and anything else, I'm so open to connecting, and you can find me on LinkedIn.
Love it. And the link to Amanda's LinkedIn will be below. So click that, connect with her, reach out, ask her more questions because she is open to it. But thank you so much, Amanda, for coming on and sharing your story and your perspectives. I really, really appreciate it.
Thank you. Thank you for having me.
My pleasure. Housekeeping items, everyone. Thank you all so much for listening or watching this. Be sure to subscribe if you have not as yet. Leave a like if you're watching it on YouTube. Leave a review and share it with a friend. That really helps the show get out to more people and shows that it's a valuable show. So be sure to subscribe, review, and share it with a friend. Appreciate you all. Peace.